The death of a young Chinese actress from cancer has provoked an agonized debate in China about when it is time to use traditional Chinese medicine used in China for centuries and when it's better to turn to Western techniques. Xu Ting shared the story of her illness on the microblogging site Weibo. Now, she initially shunned chemotherapy, choosing instead to be treated with traditional techniques such as cupping and acupuncture. When she did have chemotherapy later, it couldn't save her life. Well, let's cross over live to New York to speak to Gary Deng, who is the medical director at the Integrative Medicine Service. Gary, you work by combining traditional practices with scientific research in the fight against cancer. What is the balance, in your opinion?
In my opinion, those therapies should not be used as a first-line treatment in cancer patients. Some of them has been shown to be safe and beneficial, and they can be combined with chemotherapy, radiation, surgery, mainly used as supportive care to make people stronger and tolerate treatment better. And some of them, especially some herbal products, there are signs in laboratory studies, they may be active against cancer, but they still need to be confirmed by good clinical trials before they can be used in a widespread way. So that is a sad story that a patient shun the mainstream treatment and rely totally on this alternative therapy. I don't think that's to the best interest of the patients. But on the other hand, we also don't want to dismiss some of the good therapies that can really help people reduce symptoms and improve their quality of life.
Yes, tell us a little bit about that, because of course Chinese medicine has been around for centuries. It does do some good, it must do, otherwise why would it be so popular?
There are several reasons. One is that cancer is a very difficult to treat disease. So people want to find anything that may be helpful. On the other hand, anything with a very ancient tradition, there's always a mixture of things that are good, that stood the test of time, and the things that has been just passed down may not have some scientific evidence. So our job, like the Integrated Medicine Service at Sloan Kettering, is to do these studies to tease out which are the therapies that we can safely use and which are the ones we should advise patients to stay away from.
Is there any fear over the Western medicines, the kind of invasiveness of, say, chemotherapy that some people are fearful about?
That is true. That is, unfortunately, the current state of cancer treatment. Although some of the newer, for example, targeted therapy or immune therapy, they're very well tolerated. They don't really have as much side effect as the toxic chemotherapy. So I think people's perceptions needs to be changed, and patients should be an informed consumer of healthcare information and not fall prey to the information on the internet.
Now, how do you get that information out then? Because I know in the treatment of, say, my mother who had breast cancer, I was told not to Google, but it's impossible not to. There is so much information out there.
That's right. I think the medical professional community has the responsibilities to give patients evidence-based, but meanwhile open-minded advice and take it from the patient's perspective, take into consideration patient-centered care. So when we do it in the right way, patients actually can listen to us, but it is difficult, and that's why many academic medical centers in the United States established this integrated medicine service so we can actually do this in the proper way.
And Gary, when it comes to traditional Chinese medicine, the kind of most beneficial alleviating of pain, what is it when you're treating cancer? What are the kind of things that you go towards?
We find, not only we find in our clinical practice, but there are also clinical trial data showing acupuncture, for example, is very good for nausea, vomiting, and pain control. Some of the mind-body therapy, like meditation, yoga, qigong, can be helpful to reduce anxiety, reduce stress, and so on. And some of the botanical agents, herbal products, are currently actively under study in clinical trials for their either cancer preventive or cancer treatment effects. So we find those are the area that there's a good body of evidence suggesting they can be beneficial.
OK, well, Gary, we'll leave it on that positive note. Gary Deng, the Medical Director at the Integrative Medicine Service, joining us live from New York. Thank you.